Good afternoon. For those of you that are new to this Friday format, I am Ronald Giffler, your FMA president. We've had a series of Friday web meetings at 12 noon, focusing on the effect of this COVID-19 epidemic on the financial and otherwise practical viability of maintaining your medical practices. We've had from many other sources excellent information on diagnosis and treatment and public health aspects of this crisis. This meeting is for information to help you keep your offices open, because while many states, including our own, are starting the reopen process, it is slow. It's hard to find patients still, as well as dollars and equipment. So with that in mind, we're going to have a nice meeting, an interesting group of speakers. First, our two speakers from our federal lobbyist team, the Anway Long Group. And first to speak is Erica Long. She spoke with us several weeks back and is going to give us an update on pending possible additional COVID-19 legislation. Erica Long is the principal and founding partner of the Anway Long Group, a boutique firm specializing in healthcare policy and government relations. Clients include life sciences, payer and provider clients, as well as associations like ourselves. We've worked with this group for over about a year and a half now, at least, and they have been invaluable in helping us get our finger to the federal pulse, so to speak. So with that in mind, Erica, why don't you take it away and tell us what you think the future holds for COVID legislation?
Great. Thank you, Dr. Giffler. Thanks for having me back, guys. I hope everyone is staying healthy, but more importantly, staying sane. So the last time we talked, Congress and the administration had yet to find a compromise on CARES 1.5 or 2.0. And so they were finally able to come to the table and pass another PPP supplemental, which was great for everyone involved. So since then, Senator McConnell, the leader in the Senate, has been very clear through press reports and floor statements that he would like to press pause, and that's a direct quote. So in his words, he wants to press pause because the federal government has now passed nearly a $3 trillion piece of legislation and see where the holes fall in that legislation. So he wants to be able to get those $3 trillion out the door to where they need to be, to both providers, hospitals, doctors, states and localities, and he wants to see where the holes are. So that, in his mind, could take a couple of weeks, a month. He isn't really sure, but he sees no reason to rush back to the drawing board to pass yet another piece of legislation. And I'll just pause on this point because I think for Republican leaders or Republican members in particular, they were very quick to come and pass a $3 trillion bill. And that goes against a lot of Republican principles because none of that was paid for. And so I think now you have Republican members saying, okay, that's great. We did what we needed to do. And no one is saying that that legislation wasn't worth it. But now they're saying any future legislation, we really need to be considerate of the deficit. We need to look at pay-fors. And so I think that that's why Leader McConnell is making such a strong point on that. He also is making a strong point on liability protections. Again, this is something that he's been very vocal about and outspoken about in the press. And that liability protection is for businesses, but it also, according to the Republicans, they would like to see that liability protection extended to providers as well. So I'll give you a couple of examples on what they're viewing that to look like. So that liability protection could be extended to a provider who has said that, their state has put the lockdown on non-essential healthcare services unrelated to COVID-19. And so saying like, you know, I'm not a doctor, but, you know, let's postpone your surgery for X date. And that patient happens to get worse during the COVID outbreak, and then they go to sue the provider. So Mitch McConnell wants to make sure that there's adequate liability protection for both the hospitals and the providers offering that care. Likewise, he wants to offer liability protection. So if a provider is treating a COVID patient and using, let's say, for an example, an emergency use authorization product that the FDA has approved, but the product hasn't, because it's an EAU product, it hasn't gone through the full rigmarole of passing the FDA standard test. And that patient dies and the family gets upset and they end up suing the provider. That too would be included. Now, the Senate Judiciary Committee is holding a hearing on liability protections this coming Tuesday. And so we will keep you abreast of how that hearing goes. Typically speaking, Democrats don't support liability protections. And so this is going to be a huge hurdle moving forward on what will be able to be compromised in a phase 4 package. So turning over to the Democratic side, with both the minority leader, Chuck Schumer, and then, of course, the Speaker, Nancy Pelosi, on the House side. The House is not currently back in session. They're still in recess. They are scheduled to come back in next week. Speaker Pelosi has not formally announced the schedule for a couple of reasons. The main reason is because she says she will not call members back to vote until she has a phase 4 package ready to be put on the House floor. And if you want my honest opinion, I don't think that that package 4 will be ready in time for next week. I think that they're still working on pulling that legislative text together. So I think that the House will likely come back in the week of the 18th. So not next week, but the following week. I think I got those dates correct. That phase 4 package that Pelosi will put on the floor will be strictly partisan. There will not be any cooperation with the Republicans in the House on that legislative package. They're not talking to Republicans about what's included. It will strictly be a Democratic package pulled together, which means a couple of things. A, it'll probably cost a ton of money, and B, it will be dead on arrival in the Senate. So while it may pass the House on partisan line votes, which is to be expected, it has not a chance to see the light of day in the Senate. So, you know, Pelosi needs to pass this phase 4 package for her caucus. And I think what you'll see in there is a lot of FEMA dollars, a lot of money that goes to local, state, and governments. And Leader McConnell in the Senate has very clearly said, we've already given state and local governments a ton of money for COVID-19. What we won't be doing is bailing out local, state governments that have made bad policy and budget decisions in the past. And these COVID dollars will not be used for that purpose. So I'm not pointing fingers, California or New York, but that's, you know, what Leader McConnell's statements have been about. So we do expect that package to be on the floor. Like I said, I'm not expecting it next week. She would have already had to give members like enough time to travel here next week, and we haven't heard that yet. So I do think it's going to be the week of the 18th. 2 issues. Well, I covered one of the issues that you wanted to talk about, Dr. Gifler, which was the liability. And then there was another issue on the IRS taxation. Is that correct?
Yes, and those programs that were for a finite period of time, such as the advanced payment program, is there any talk about extending any of those?
Not yet. I haven't heard any talk about extending those programs yet. But again, it will depend on how much money goes out the door, how quickly they run out of those dollars. And so, for example, Mitch McConnell has said, you know, we need to give it time to see how the dollars end up and where the holes are. So in his mind, they're not going to pass another piece of legislation until they're going to be forced to do so, which means like a program will run out of money. So no, to my knowledge, they haven't talked about reauthorizing or re-upping any of that money yet. The other issue on the tax, I lost my train of thought. On the IRS tax issue, it's both an issue that Chairman Grassley with the Senate Finance Committee in the Senate has said that he's interested in finding a resolution for, and likewise across both the aisle and across the chamber on the House side, Chairman Richie Neal from Massachusetts, Democrat from Massachusetts, has also said that he wants to see that resolved. So you've got both chambers on both sides of the aisle saying that they want to quickly work to resolve that issue. So I do anticipate that that issue would be both in Pelosi's phase 4 package and then hopefully whatever compromise version comes out of phase 4. And that's it.
All right, thank you very much. Next, and first for our viewers, will be Allison Anway. She is the other principal and founder of the Anway Long Group. She has more than a decade of health policy experience, having served in an advisory capacity in both the Senate Finance and the Health Committee, and has been involved in nonprofit organizations and public policy for a global biopharmaceutical company. This broad range of experience has given her expertise in insights into Medicare, Medicaid, the Affordable Care Act, and value assessment. We are privileged to have her talk with us, and she is going to talk about a variety of issues, particularly focusing on some of the longer-term impacts of this mess we're in right now. Thank you, Allison.
Thank you so much, Dr. Gifler, and it's great to be with you all today. So obviously, Erica just walked through a lot of the, sort of short-term impact of COVID-19, all of the things that we're watching happen in real time unfold in DC. But something else we've also been doing a lot of thinking about is the longer-term impact of COVID-19, both from the perspective of the impact on the healthcare system in the U.S. and on public policy that we might see coming forward from this. So I want to talk about 3 trends that we think are going to be the major contributors to the changes that we are likely to see in the ecosystem and in public policy as a result of COVID. And the first one is something that has been a little bit of a sleeper issue, but I think is going to be really important for you and your practices. And that is the degree to which the economic contraction is likely to fuel some pretty major shifts in the sources of health insurance coverage for Americans. So as you probably know, the employer-sponsored health insurance market has been really the bedrock of the sources of coverage in the U.S. for many, many decades. In 2018, 49% of Americans got their health insurance coverage from their employers. And employers typically offer pretty generous health insurance packages to their employees and typically reimburse at a higher rate. Now, what we are likely to see, though, with the economic contraction, the U.S. economy has now lost 33.5 million jobs in the last 7 weeks. And so what that means is that a lot of people who were getting their health insurance through their employer are now likely to get it through Medicaid, which reimburses at a much lower rate, as I'm sure you're aware, or in a state like Florida that hasn't expanded Medicaid, these people could be added to the rolls of the uninsured, which could increase the incidence of uncompensated care and just generally have a downward effect on healthcare utilization for that slice of the population. At the same time, the stock market has been super volatile. I don't need to tell you that. And it's really done a lot to threaten people's retirement savings. And so we could also start to see some seniors moving into more of the low income subsidy population or the dual eligible population, which also has reimbursement consequences for providers. The second trend that I want to talk about is this idea of the 3 stages of the COVID-19 utilization tsunami. So I use the term tsunami, the metaphor tsunami, because I think it's kind of a really interesting metaphor for what we're seeing in terms of healthcare utilization during this time. So in stage 1 of this crisis, we started to notice that utilization of the healthcare system dropped dramatically. And that was largely driven by the fact that elective procedures were disallowed, also that people were starting to feel uncomfortable going to their doctor's office. And so outside of the COVID-19 hotspots, utilization really cratered. And I know you guys are all feeling that in real time. But in some areas of the country, this was quickly followed by a second stage where healthcare utilization, specifically of the hospitals, really exploded due to COVID-19 becoming more widespread in its impact. And then we also have observed that some regions of the country are already starting to go into this third stage. Some regions of the country have actually skipped the second stage and gone straight to stage 3, where we expect to see healthcare utilization rise precipitously, mostly due to pent-up demand from all of the folks who were putting off their elective procedures. And we're also thinking that this stage could be accompanied by possible second or even third waves of COVID-19 utilization. So the complicating thing about this utilization tsunami in these 3 stages is that none of these stages are unfolding at a uniform pace or sequence across the country. As I mentioned, some regions are already in stage 3. They've lifted the ban on elective procedures. We're starting to see utilization tick up. Others are sort of in this like no man's land between stage 1 and stage 2. They're still not sure whether they're going to get hit with a huge COVID surge. And so what does this mean for the aftermath? What is this going to look like? What is this going to do to the healthcare system long term? And I think the short answer is we're going to see even more variation region by region in the country as the stages sort of unfold at different rates and in different sequences. So that kind of takes us to the third trend that this is an existing trend. This is not something that was caused by COVID-19, but we definitely see a large potential that COVID-19 could amplify the existing geographic care and access disparities that already exist in this country. So what this slide shows is 2 things that we're tracking. So the first is the purple stars. These are states that have a very high percentage of their population who are deemed at risk for having a serious illness connected to COVID-19. Either because they have advanced age or because they have a combination of underlying comorbid conditions that make them higher risk for this serious illness. And you'll see that a lot of these purple stars are also in orange states. And the orange states are the states that did not expand Medicaid. And you'll see that Florida is both a purple star and an orange state. So basically what that means is that if we do see a very large uptick in people having serious illness related to COVID-19 in Florida, there is a bigger possibility that those people will be uninsured. And so, we just think that that's something that's important for us to track because we think it could have important consequences for both the system, the healthcare system, and for public policy at the state level. So with all three of those trends in mind, I know there's a lot of words on this slide. I'm not going to read it to you, but I can just sort of give you a snapshot of what we think these three trends will have in terms of an impact on sort of the big stakeholders in the healthcare system. So clearly, stage one of the tsunami, which we already sort of discussed, has had a huge negative financial impact on hospitals and physicians. The elective procedures, the fact that people aren't going to office visits. And at the same time, hospital-based physicians in particular have put themselves at enormous personal risk to the extent they're in a COVID-19 impacted area. At the same time, sort of paradoxically, the health plans have seen very low financial exposure. And this is because they're not paying claims because no one is going and getting any, procedures done. So their medical loss ratios are very low right now. However, while they're sort of sitting on these, these bigger reserves, they're keeping a very close eye on what might be coming, both in terms of COVID-related claims and in terms of the pent-up demand effect that I mentioned before. And they're also seeing a lot of their employer plan business start to fall off as employers go out of business, lay off employees, et cetera. So they're losing those premiums at the same time. So they're sort of trying to, and they're in a situation in June where they're going to start having to submit their rates for 2021. So they're trying to figure out how to price all of these unknowns into those rates. In stage two, stage two and stage three, the thing that we're really tracking in terms of impact on hospitals and physicians is that change in your payer mix. Financial pressure is likely to continue, but even when the pent-up demand effect takes hold and, people start going back to get their elective procedures and see their doctor, we just want to start paying attention to what the changes to the payer mix are. So if you go from having a large percentage of your patients having employer-sponsored insurance, but now they're on Medicaid or they are uninsured, this could be sort of a growing issue for providers. And then at the same time, the health plans, again, I think are going to be trying to figure out how to price, how to ensure that they are able to keep their employer business and not increase premiums too much. And at the same time, probably coping with some higher claims volume that they'll have to pay. So those are sort of the major impacts that we see on the system. And we expect this to have a pretty significant impact on how public policy emerges coming out of the COVID-19 crisis. So we're tracking sort of three emerging policy themes that we think will come up. The first one is sort of the public payer crunch. As Medicaid grows, that is obviously a huge budget item for states. And at the same time, the economic contraction is going to mean less in terms of tax revenues for the state budget. So, Medicaid already has very low reimbursement rates, very challenging enrollment standards for people. So that is, we think, likely to just be exacerbated by the fact that the Medicaid rolls are growing and tax revenues are going down at the same time. We also are watching, what the impact of having a large growth in the uninsured population, what that will mean for the public's appetite for either a public option or Medicare for all. And of course, in the state of Florida, will there be a renewed push to expand Medicaid? Obviously, all of these things would have a huge impact to reimbursement rates across the board for drugs, for doctors, for hospitals. Everyone would be sort of impacted from a reimbursement perspective by this public payer crunch. The second emerging policy theme that we see is this idea of innovation by crisis and not by design. So, obviously, COVID-19 has been a massively disruptive event for the entire healthcare system. And the administration and Congress have really responded by issuing just tons of flexibility. Keeping up with the deluge of, it feels like every day they come out with a new, flexibility, whether it's telehealth, whether it's site of care, whether it's allowing physicians to, work across state lines, increases in scope of practice, and all of these things are being done in a temporary manner for the most part under the public health emergency. But, I think most people are starting to ask, what happens once the crisis is over or stabilized? Some of these things are really difficult to sort of put back in the bottle. So what happens with telehealth going forward? Does it become a permanent part of your practice, or does it get unwound at the end of the public health emergency? So all of these conversations are starting to be had and will be a pretty significant area of policymaking, for the foreseeable future. And then the final policy theme that we see emerging is this question of really, will there be any money left for anything else? As Erica said, we have spent $3 trillion in a record time. I don't think we've ever spent that much money as a country ever in a year. The capacity for the federal budget and state budgets to withstand this kind of deficit spending at the very same time as the economy is contracting, tax revenues are contracting, is really going to put a lot of pressure on the government's ability to pay for many things, and Medicare and Medicaid, sort of across the board. There's going to be this financial fiscal sort of reckoning that's going to happen at some point. So, how does that manifest itself in the policy arena? That's going to be another key area that we're watching very, very closely. So this is my last slide, and this is sort of my caveat slide, which is, obviously things are super uncertain right now. No one is really sure what's going to happen next. And there are some very important variables that could absolutely change everything that I just said. So, first and foremost, how far is the virus really going to spread outside of the hotspots? How long are each of these stages of the tsunami going to last? Will the actions by Congress that they've taken so far and the Fed have taken so far, will they be successful in stemming the economic recession? That would be wonderful if they could actually, slow or mitigate the recession. What's going to happen as states reopen? Is the epidemic going to reoccur? Will it come back in the fall? That's a huge unknown. And then, of course, maybe the most important variable from my perspective is, when are we going to have widespread access to rapid testing, better treatments, and a vaccine? So all of those variables could change the projections that we just went through, and we'll be watching them all very closely. And that's the end of my presentation. So Dr. Gifler, I don't know if you want to open it up for questions or take over.
Well, we have a couple more speakers, so hang on, and we'll take all our questions at the end. Thank you. Our next speaker is Jared Fowler. We all have spoken and heard Jared before. He's Director of Healthcare Policy and Innovation for the Florida Medical Association. His primary responsibility is to analyze state and federal policies affecting the practice of medicine, healthcare payment modalities, delivery, managed care, and health information technology. He works tirelessly to keep us up to date on the financial aspects of all these government programs, which appear to be changing weekly, if not daily, including the various amounts of government money and how one can go about securing some for their own practice survival. So Jared, take over and tell us what's new.
Hey, Dr. Gifford, thank you so much for the introduction. I'm glad to be here again with everybody today. If you've been on a few of these webinars in the past, you've probably heard me talk quite a bit. Today my presentation will be relatively short, but I just want to give an update on a few important policy changes that I think this group will appreciate. First and foremost, if you haven't heard it already, some good news. Good news is always something that I enjoy sharing, which is on April 30th, CMS announced that payments for audio-only telephonic E&M codes, 99441 through 99443, will now be reimbursing at the same rate as in-person services, which is to say that the payments for these services under Medicare fee-for-service will jump from about $14 to $41 to about $46 to $110, and this change is actually retroactive back to March 1st. So if you build, these audio-only telephonic E&M codes back in early March, your payment under the Medicare fee-for-service system should be now in line with your other evaluation and management codes. That is great. So we think that, that's very good news. It's something we advocated strongly for. A lot of people made the point that, hey, look, we have a lot of folks who just are really struggling to deal with this requirement that there's a synchronous real-time audio and video, and that there's really no difference in the amount of cognitive labor and effort that's required to perform these services on an audio-only basis. So it's terrific that for the time being, HHS or CMS specifically has decided that they're going to pay for these services at parity with other E&M services. We think that that is phenomenal news. Aside from that, next jump into here is that many of you are probably aware by now, HHS is distributing its second tranche of money under its general distribution of payments out of its $175 billion in total fund that was allocated by Congress to help provide relief to hospitals and physicians and other types of providers as it related to the COVID-19 pandemic. So the first $30 billion tranche, many of you probably just received the money immediately in your account. And we went over that, how that worked. You noticed that United Healthcare gave you this payment that was equal to about 6.2% of your 2019 Medicare fee-for-service payments. And, now, as many of you are aware, they have started making payments under the second $20 billion distribution. And the eligibility requirements for this, basically this second tranche of money will go to the same group of people who received the first tranche of money. But there's a crucial difference, which is that for people who received the second tranche of money, HHS only sent it to you automatically if they had enough cost data on file for you. And generally speaking, for physicians, they didn't. Generally speaking, the type of people who file cost reports with HHS are hospitals. And so a lot of physicians didn't receive the second tranche of money automatically. And so in order to get this second tranche of money, the second distribution, you actually have to fill out some paperwork on the HHS Provider Relief website, submit some data, and of course, you'll have to sign a set of terms and conditions similar to what you signed last time. And, of course, make sure to, read carefully all of the instructions, understand what you're agreeing to. But the bottom line is that like with the first tranche, unlike the first tranche of money, in order to get the second tranche of money, you do have to fill out most physicians in any case will have to fill out some cost report data. And we can kind of get into that if anybody has questions. I think a lot of you have probably seen this by now, but I just am making this aware to anybody who may have somehow missed it. And if you need help figuring out where to go, where to get this information, we sent out in the FMA news the other day, which should have reached substantially all of you, an alert that has links to the general distribution portal where you will fill out that cost data if needed. a link to an FAQ guide that has eligibility information, and also there is a link to a guide in there that the AMA has put together that provides some nice pictures and makes it a little bit easier to get an understanding of what you're sort of looking at as you fill in some of this data. And also, furthermore, one thing that I think is really crucial to mention, because it's not clear on HHS's website, is that there is a number that you can call if you have questions and you need to talk to an actual person. The HHS Cares Provider Relief Line, which is 866-569-3522, and that's also on that AMA fact sheet that we link to on our page that I mentioned, and in our fact sheet itself. Again, there's a line that you can call for questions and information for the CARES Provider Relief Line, which is again 866-569-3522. So if you have questions, hopefully that information that I just referenced will answer it. And you can also speak to a real person if you call that number. I'm not actually sure what their hours of operation are, but in any event, that is HHS's official line for assistance. So I'll go ahead and kind of move on. Oh, another thing actually I want to mention, dovetailing off of that. So you may ask, well, what if I'm not eligible for this general distribution for this first or second tranche of funds that have been sent out by HHS? And I want to point out that, there will be additional targeted distributions, and there's already a little bit of information up on HHS's website about some of those targeted distributions. But if for whatever reason you're not eligible for any of the general distribution funds, HHS has money left that they're going to spend. And there will be additional targeted distributions to providers who maybe didn't receive very much in the way of funding from this first two tranches of funding. And in addition to that, no doubt, again, be future distributions of some kind as well, as HHS looks to spend the money that's already been appropriated. But moving along now, I think many of you are also aware that as of April 26th, the Centers for Medicare and Medicaid Services is no longer accepting applications for the Medicare Advanced Payment Program, which we believe is unfortunate. The Medicare Advanced Payment Program, while it was those payments under that program had to be repaid, they were loans essentially. They were not grants, and there were some other things about them that were imperfect. We strongly disapprove of this, and we will, of course, advocate that Congress and its next piece of legislative relief, whenever that comes, include basically some sort of some improvements to the Medicare Advanced Payment Program, and preferably also just explicitly reauthorizing it. We hope that that'll happen, but just know that CMS is no longer now accepting new applications for the Advanced Payment Program. Finally, physicians who provide COVID-19 related treatment to uninsured patients are now eligible also to receive payments at Medicare rates for qualified services. And, there's some terms and conditions, as there have been with these distributions of funds, and some restrictions on balance billing, that kind of thing. But the bottom line is HHS now has a web portal, which you can access from the HHS Provider Relief website that so many of you have now seen. And, basically it'll explain the program, how it works. I can get into it, but I know we're kind of pressed for time here. Basically the bottom line is, know that if you're treating patients who have COVID-19, who are uninsured, and you're wondering if there's any sort of way that you can get reimbursed in any sort of way, the federal government does have this program with a couple $2 billion of funding allocated to it to reimburse providers at Medicare rates, and that is subject to funding, but it is something that hopefully will provide some relief to folks who are maybe in hotspots where there's a high rate of uninsured patients. And obviously we know there's a growing rate of uninsured patients who have this terrible sickness. So again, if we get into it in questions and answers, I'm happy to provide more detail around any of these programs, but I want to close in here in a minute, just in the interest of time. And thank you again for listening, for tuning in. And, I'll kick it back to Dr. Gifler.
Jared, before we move on to Jeff, I just want to ask you one quick question. Was in our question queue. Of the various programs you're mentioning, are there any or targeted toward Medicaid providers?
So that's a good question. The answer to that question is, if you did not bill Medicare in 2019, under the current guidance that HHS has on its website, You would not receive money for this this general distribution, this $50 billion that's come out so far. However, if you received money under the first tranche of funds, and you receive very little because, say, Medicare fee-for-service volume, constitutes very little of your overall revenue, you would still be, because you received money under that first tranche of funds, eligible for money under the second tranche of funds. The way that this works, to try to explain it, is that, under the first tranche of funds, basically you receive 6.2% of your 2019 Medicare fee-for-service billings, right? So $6,200 for every $100,000 you billed in Medicare fee-for-service or received in Medicare fee-for-service revenue. For the total distribution, you would calculate that as individual provider 2018 revenue divided by 2.5 trillion, multiplied by 50 billion. And so now you notice that we have like a formula here, right? X plus Y equals Z. X was the first tranche of funding, $6,200 for every $100,000 that you bill, in Medicare fee-for-service. The total amount of money that you would receive is roughly equal to $20,000 for every $1 million in provider revenue. So let's just say that you had $1 million in total revenue, right? And 250,000 of that was Medicare fee-for-service revenue. That means that you would receive 15,500 from the first tranche of funding, and that your total would be $20,000, which means that you would receive an additional 4,500 from the second tranche. Now, the thing that's crucial to note here is that, in other words, let's just say, again, you had $1 million in provider revenue. Well, let's say that you only billed Medicare $100,000, right? In 28, and so now it's 6,200, in the first tranche, 20,000 in total, and therefore you would receive, what is that, 13,800 in the second tranche. In other words, the size of the allocation under the second tranche of funds will be larger for providers who were primarily dependent on sources of revenue other than Medicare fee-for-service. And therefore, Medicaid dominant and commercial dominant providers can expect to receive more money, relatively speaking, to other providers under the second distribution. However, if you exclusively build Medicaid, let's just say, for argument's sake, HHS has noted that it intends to create additional targeted distributions for those providers, but no further specificity is provided on the HHS website in terms of how that is going to work. And also another thing I want to point out is I mentioned the eligibility parameters as they currently exist on HHS's website. This is something that the AMA and a lot of other organizations have put back on, that this first general distribution is, it's limited, and not every provider, including some, say, pediatricians and some OBGYNs, will qualify. Since some of them didn't bill Medicare at all in 2019. And because HHS is receiving pushback on this, there is hope that, maybe they'll reconsider, right? And maybe they'll expand the eligibility under this program. We can't obviously guarantee that, and it's not worth a lot of time. It's not really worth a lot of effort to speculate on it, except to say that you should, of course, continue going forward to check the HHS Provider Relief website and check for updates. If we get updates, if we get new information, if we find out new people are eligible, we will update you immediately. Currently that the first and second tranche of money was limited just to people who billed Medicare in 2019, and the second tranche is limited to people who received funding distribution under the first tranche. At the end of the day, that could expand, that could change, and we'll be providing updates as quickly as we can, and of course advocating for additional relief for Medicaid-only providers. Or providers who just, have had no Medicare experience, because we do, of course, understand that that group needs relief as well. And again, there will be targeted distributions according to HHS to that specific provider demographic as well. Thank you.
Thank you. Our next speaker is Jeff Scott, our General Counsel. He handles our legal affairs and is extensively involved in representing the FMA before the Florida legislature and executive agencies. Jeff will give us an update on events affecting us coming from Tallahassee, Reopen Florida, and the status of any of the changes in the executive orders there too. Jeff?
Thank you, Dr. Gifler. This is going to be very brief because my focus was on the emergency order 20-002. This was an order issued by the Surgeon General on March 20th and then extended again on April 15th. what the order does, it did several things, but of most interest to physicians, and what's causing a lot of concern presently this week is the provision that allows physicians to provide controlled substance prescriptions for the relief of chronic non-malignant pain in regards to existing patients. And it also allows for physicians to continue medical marijuana certifications for existing patients as well. This order was set to expire today, and we received a number of requests for the FMA to try to do whatever we can to get the order extended. We reached out to the Surgeon General, the Department of Health, the Governor's Office on Wednesday. We made it known that we supported the extension very strongly. We worked with SIP and other pain organizations, Florida Academy of Pain physicians and others to try to get this order extended. And I was hoping to have a detailed analysis of what has happened. The governor did a press conference today at 11 o'clock. I was expecting an announcement at that point on this order. The emergency order that he issued declaring a state of emergency in Florida, that was Executive Order 20-52, also expires today. And I was expecting an announcement on both of those, but he didn't mention either one of them. So I shot an email to the Governor's General Counsel, and I got a one-word response or a one-sentence response saying that the order has been signed. Unfortunately, I don't have any more details than that. I've been looking on the website to see if the order is out. It is not out as of yet. So all I have is the governor's office word saying that the order has been signed, and I'm assuming that would be 20-002, that will be extended, but I won't have any additional details until the actual order comes out, hopefully sometime today. So as soon as that is out, we'll put it on our website and we'll make that information available.
Okay, thank you. We have a number of questions by our audience. Matt, you want to just start at the top and read some of these off, and we'll figure out who best to answer?
Yes, sir. I can go ahead and do that. First one is there any fallout from Allison, any fallout from the War Powers veto WRT COVID issues quid pro quo?
Well, I think that would be for Jeff or Allison. Is Allison still on the call?
I am, yes, I am.
I lost your picture.
That's okay, I can put it back on. So no particular fallout that I'm aware of, but I can look into it. Obviously partisanship has returned to the Capitol, and we're starting to see a lot of oversight come out of the Democratic side. A lot of finger pointing about how, President Trump and the administration have handled the response to the crisis. So just like general, overall finger pointing and that sort of fallout. Yeah, that kind of was expected though.
Thank
you.
you.
The next one I think would go to Jared. Any word on federal grants for Medicaid doctors yet? Medicare got grants twice now.
So I think that we just went over that.
I jumped the gun and asked Jared that a couple minutes ago.
I will say though that I did receive word from Erica, who jumped off the line, that according to some intelligence that she has, their HHS is planning to spend $10 billion on high volume Medicaid providers at some point, but that they are still figuring out the formula for how that distribution will work. So as I mentioned previously, HHS has announced that they intend to do something for Medicaid only providers. It sounds like that something is still in the works. So I can't give you any more information than that.
Okay, we had another question about the immunity from legal malpractice claims. I want to point out to everybody that in your FMA news yesterday, you got the lead story was something where you could send an automated letter to Governor DeSantis showing your support for the letter we've sent asking for relief. We have another question here. Given impacts discussed and policy themes, Allison, what is the action items the FMA can do to affect those items now rather than monitoring?
Yeah, so I mean, I think the biggest sort of take-home point that I would encourage folks to think about is just how important it is to try to protect the employer market for health insurance and try to avoid that, all that leakage into the Medicaid channels or the uninsured population. So there's a lot of work happening on Capitol Hill to try to think about, how to keep employers whole, obviously, keep them, in business, and then even further keep them offering health insurance coverage to their employees. And I know that's not something that, probably a lot of non-health plan stakeholders, would get involved in, but I think everyone is starting to see how important that market is to their bottom lines. And so, I know like the pharmaceutical industry and the hospital association and many of the provider groups are at least supporting what the health insurers are suggesting in terms, and the employer groups are suggesting in terms of trying to save that market. So that's, and of course, that's on top of the more direct effort that we're doing to try to make sure that providers also are eligible for these rescue funds, and at the same time, looking out for unintended consequences and trying to make sure that surprise billing doesn't get attached to any of these bills. So, but yeah.
Okay, the next question is about guidance for reopening your practice. We actually had a document that our general counsel, Jeff Scott, put together on this and was in FMA News yesterday. If anybody would like another copy of that, either look at your FMA News or send us an email to membership@flmedical.org. That is membership@flmedical.org, and we can send you a copy of that document. Okay, next one we have is for Jared again. I read HHS overpaid some physicians for the first payment and they're asking for refunds. Have you heard this as well?
I have not heard that. I'd be interested to hear your source if that's a widespread issue. Certainly, it's not inconceivable that they, in the process of pushing out $30 billion of funds on an automated basis, made some errors, but I have not heard of that as a widespread issue.
Okay. PPP loan forgiveness. Would subscriptions to electronic health records be considered a utility and therefore allowable non-payroll 25%? I'm seeing this question, and I think next week we're going to have on some accounting experts that can speak to a lot of these questions.
Yeah.
So any of the IRS questions or reporting questions, be sure to log back in next week. If you can't log in next week for some reason, just send us a email to membership@flmedical.org, and we will do our best to get you an answer on those then. Okay, here's another one. Is there a website reporting the number of nursing home facilities having COVID-19 patients and how many have died?
I don't know the answer to that myself. Jeff, is that something you might know?
I believe it's on the Department of Health website. I'll have to find the actual link. I'm not familiar with it right now, but I can find it. We'll put it on our website.
I believe that information has been recently released. There was some controversy about it, but it is now available.
All right, I think that's about it for the questions for now. If you did not get your question answered, please send us an email to membership@flmedical.org. That is membership@flmedical.org. And as I mentioned earlier, next week, be sure to log in again. We'll have accounting experts talking about some of these tax implications and other exciting issues. Dr. Gifler, I'll turn it over to you for closing.
Well, thank you all very much. And we look forward to being able to provide you additional and ongoing support, and we'll have a meeting the same time next Friday. Thank you all.
Thank you.
And enjoy your weekend.